I tell everybody, nobody plans a car crash. And when those things happen, unfortunately, the medical needs arise, and healthy people tend to go with the lowest premium without planning for the future. So I would just make it a request for consideration that plan for health for long term.
Hello and welcome to the Hi-Fi Health News Podcast. I'm Erica Grotto. If you're nearing the age of 65, I have some important information for you today about Medicare. Medicare is a federal health insurance program, and if you're enrolling for the first time, there are some things you'll want to know about how it works. Joining me today is Dr. Deepak Goyal, a physician and executive medical director at Monument Health in South Dakota. Deepak, I mentioned the age of 65 at the top of this segment for a reason. That's generally when people first qualify for Medicare, but when are other times that you can qualify?
First of all, thank you and good morning, Erica. And it's a pleasure to be here with you. And as you mentioned, while 65 is the most common qualifying criteria for Medicare, there are other pathways which individuals can qualify. For example, and they don't have to be over 65. For example, if certain individuals have disabilities like end-stage renal disease or last stage of kidney disease, which might require dialysis or that might require transplantation, or they have a disease called amyotrophic lateral sclerosis or Lou Gehrig's disease. These are the people who can also qualify. There might be other criteria. For example, a person might be on Social Security disability insurance for 2 years. These are criteria that people might qualify for. Again, it is best to verify the eligibility with Social Security Administration or Medicare.gov. And also one thing to mention, this can become very confusing for people who to approach Medicare or Social Security Administration. The Medicare program is implemented by CMS or Center of Medicare and Medicaid Services, yet the application is processed by Social Security Administration. So that is the differentiation between these two.
Can we talk a little bit about when you can enroll? It's around age 65, but there are certain months that you can do that, right?
True. So what you're talking about is the enrollment periods. So I'll just go through the high level overview of all enrollment periods. So one is what you call initial enrollment periods, and that is what you are referring to. So this is actually a 7 months qualifying period when individuals turn 65. For example, say somebody's birthday is on April 15th. So the 3 months before, that would be January, February, and March, April included, and 3 months after, May, June, and July. So these 7 months, any individual can enroll for Medicare.
So there are 4 parts to Medicare, A, B, C, and D. Can you briefly talk a little bit about each part and what they're for?
Absolutely. Think of Medicare as a comprehensive package with very distinctive components. Part A or Alpha would be covering hospital care, inpatient stays, skilled nursing care, hospice care, and some home health services. In brief, we can very safely call it a hospital insurance. Part B would be covering outpatient medical care such as doctor's visits, preventive services, and durable medical equipment. In a nutshell, we can call Part B as a doctor insurance. And then Part C would be a plan that is covered by private insurance companies who contract with Medicare. And they might have both the doctor insurance and the hospital insurance covered into one. And they might also include something called Part D. Part D is the plan for prescription drugs. So understanding these parts is very essential to navigate Medicare very effectively. And also one way to think about this is on one side of the equation would be Part A, Part B, and Part D. That's what we call original Medicare or traditional Medicare. And Part C would be on the other side of the equation. That is Medicare's plan basically implemented by private insurance companies.
And there's also Medigap coverage. Can you explain what that is?
Sure. Medigap is also known as Medicare Supplement Insurance. It is an insurance policy that might help fill the gaps in original Medicare, means Part A and Part B, because when individuals have Part A and Part B, there might be co-pays, co-insurances, deductibles. So these plans might offer greater financial protection for those patients. It is also very crucial to note that Medigap is separate from Medicare Advantage, and any individual cannot have a Medicare Advantage plan and a Medigap. Medigap only goes with original Medicare.
Okay, so we're going to talk a little bit about the kind of decision-making process if you're going into Medicare for the first time, choosing between traditional Medicare and Medicare Advantage. But first, I think it's important to cover a few basic terms. You mentioned copay, deductible. Can you just go through a couple of these? These are things that everyone needs to know, whether they're on Medicare or an employer plan or whatever kind of plan they're on.
So first term obviously is a premium, which I'm pretty sure insurance companies are always happy to have, and it is a monthly payment you make to maintain the coverage, whether it's your car insurance, it's the same term premium, or healthcare coverage. Then the next term that is deductible. This is the amount an individual pays out of pocket before the insurance starts to cover the costs. So third term is copay. This is a fixed amount an individual pays for a specific service. For an example, a doctor's visit. An example would be, say I go to my primary care doctor, and that clinic might have a copay anywhere from $50 to $150. And the next important term is co-insurance. So this is a percentage of cost that you pay for the service after you have met your deductible. For an example, I have back pain, or my doctor orders an MRI for my back or for my head, and there might be 20% co-insurance that I would be paying after I met my deductible. The next term is out of pocket maximum. This is the maximum amount an individual would pay in a year. After that, everything is covered by insurance. There is no more financial burden on the patient after that. So knowing these terms will help anybody understand their financial responsibilities, not only under Medicare but under any insurance.
Thanks so much for those explanations. I think they'll be really useful to folks. So let's talk about how Medicare and Medicare Advantage are different. How you want to decide between the two if you're making a choice between them as you enroll for the first time. So traditional Medicare, as you mentioned, is parts A, B, and D. Your hospital care, your doctor care, and your prescriptions. Part C is that Medicare Advantage plan where it's all kind of combined, which I think is a little more like what we're used to if you have insurance from your employer. And actually, when you purchase an Advantage plan, you get it from a company that you might recognize the name of, right? You mentioned, Deepak, that you get it from a private company. It's something like Cigna or Blue Cross or Humana or, any number of insurance companies that you might have gotten your health insurance through before. But it works a little bit differently. What are some of the pros and cons? What are some of the things you need to consider as you're making the decision between traditional Medicare and Medicare Advantage?
So Medicare Advantage plans often resemble the employer-sponsored plans. Often these companies are also the same, but they come with some network restrictions and also managed care features. And yet the individuals who might benefit from those Medicare Advantage plans could be those individuals who prefer a single plan that combines hospital, medical, and prescription drug coverage into one, rather than having to be enrolled into separate branches of a particular other insurance like Medicare. And also individuals who might value extra benefits like vision, dental, hearing coverage, or gym memberships. So these are the things that are offered. But also they might come, as I mentioned, with network restrictions. What that term means is that you might be able to see only certain providers, not any provider. And also with the managed care features, that might mean is there might be a burden of pre-authorization before getting certain services, which might be way less on Medicare. So again, these are pros and cons. And as you mentioned, what decision making or data points somebody should be taking into consideration, I think understanding both of the insurances, original Medicare and Medicare Advantage plans, their premiums, copays, and also their own patient's own healthcare needs, because there might be limitations to the specialist, what kind of specialist you need, what kind of doctor do you have, is your doctor in the network for that Medicare Advantage plan, that these are what kind of drugs you are on, what kind of prescription medication you take. So these are some of the factors to be considered. As I always say, all insurances are good till the time you need them. So you have to make that decision, and talking to the senior network and talking to people who are in your community might already be on one of those plans. I think it goes a long way.
What are some other considerations or decisions you might need to make when moving into Medicare and adjusting maybe to a plan from your employer into some type of Medicare plan?
This is a very tough decision, and also a lot of things that go into making the decision. I just want to acknowledge that it's not an easy process, but taken due time and due process, I think it might become easier and might go a long way. So a few points, as we discussed, first of all, the choice between original Medicare and Medicare Advantage. There are several other data points and decision-making points which I would recommend strongly to be used. One is obviously the timing of enrollment. Understanding the initial enrollment period, which we have talked about, and potential penalties for late enrollment, that is vital. We cannot have late penalties over there because they just take along for a long time and can be financially burdensome. Second is, if an individual decides to go with original Medicare or traditional Medicare, it's very important to find the right Medigap plan that might give or offer a lot of financial protections. Third is prescription drug plan coverage. If a person is opting for original Medicare, it needs to be decided what kind of Part D plan to be chosen. And also it is very important to verify that if somebody is already on prescription medications, is that Medicare Advantage plan covering those drugs? It's a good discussion to have before before the signature is done on that form. And any specific needs, individual health needs. Who is your doctor? Is the doctor in the network if you're going with the Medicare Advantage plan? Do you have any need for any specialist services? Do you have those specialist coverage within your area by your insurance so that it can avoid a lot of surprises later on? And as I mentioned multiple times before, taking input from people who have already gone through the process, it would be of great help.
Something that I think surprises a lot of people, it's come up on this podcast a couple of times before, is that looking forward, you might be a healthy 65-year-old, but looking forward into the future to a time when you might need long-term care. Medicare doesn't cover that. Medicare doesn't cover nursing home care long-term. There are certain very specific things that it will cover, but Medicare doesn't take care of that for you. So that's
That
something definitely noteworthy as well.
that unfortunately is a system, as designed. And people who are very healthy and have no medical needs at this point of time, and there are a lot of you know elder adults who are very healthy. But I tell everybody, nobody plans a car crash. And when those things happen, unfortunately, the medical needs arise. And healthy people tend to go with the lowest premium without planning for the future. So I would just make it a request for consideration that plan for health for long term. How does it look like? What suits my needs? God forbid I get sick in 3 years, 5 years. And I've seen few adults, who were healthy, and all of a sudden they're diagnosed with a very bad cancer. And what do you do now? So those needs have to be considered about what if scenarios that might help a lot.
And if this sounds a little bit overwhelming, you can learn more about all aspects of Medicare at medicare.gov. That's all for us this week. I'm Erica Grotto for Hi-Fi Health News. Thanks for watching.